Welcome to Incus Learning App. Become a champion in concepts in cardiology. Every concept in 3 minutes because our attention span is very less as medical students. Now I am going to make you the champion in the topics of murmurs. Systolic murmurs, diastolic murmurs. One of the favorite question both in ward rounds, NEET PG, USMLE, any exam you go. Systolic murmur. Typically, systolic murmur is seen in 3 scenarios. One is aortic stenosis, second mitral regurgitation, mitral valve prolapse, and flow murmur. These are the 4 scenarios. So you can easily remember, whenever the heart is undergoing systole, ventricle is undergoing systole, the blood is trying to negotiate through a narrow stenotic valve of the aortic stenosis, so it makes murmur. When the ventricle is undergoing systole, there is a regurgitant blood pushed back into the atrium, hence mitral regurgitation is also a systolic murmur. Whenever we say systole, it is the systole of the ventricle. Similarly, any mitral valve prolapse also, typically there is a sound during the systole. Any flow murmur like anemia, beriberi, or typically whenever the patient is having a flow murmur, which are all generally functional, they are all systolic murmurs, right? So let us be very sure. Systolic murmurs, in aortic stenosis, it is a harsh systolic ejection murmur and it radiates to the carotid. So typically, whenever aortic stenosis is responsible for the systolic murmur, radiation is to the carotids. Similarly, mitral regurgitation is a hollow systolic murmur. Zzz, 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 like a honeybee. You can't listen S1, you can't listen S2, only you will listen murmur. And it radiates to the neck. Whereas, the mitral valve prolapse, typically, it is a mid-systolic or late systolic murmur with a preceding click. So that is the nature of MVP. So